Hey everyone, welcome to another edition of Ladies Edition with myself, Shelly Cheyenne, and
Shameika, because I'm such a fun person. And look, y'all, we came back. We told you we'd be right back.
and it didn't take us that long this time. It didn't take us that long, so that's a good thing. So we're actually going to have a good conversation today with our very own Shameika Rhymes. I'm gonna do something that we do for our guests because you are a guest today as well as a co-host of ours here. Um, but I'm going to introduce her officially because we get ignorant around here and we just start talking. Shameika Rhymes is a North Carolina based freelance writer that loves writing about culture, lifestyle, and entertainment and in wellness. Yeah, wellness. Her bylines include In Her Sight, ET Online USA, Today, magazines, Shondaland. Okay, we can't forget that. Parade and Zola.com. She's also done a host of other things. She does Check the Rhymes is her brand, her thing. And she also does blackdoctors.com, or is it .org?
.org.
.org. I thought it was .org. Blackdoctors.org. And she is the host and creator of her entertainment platform, Check the Rhymes, which I absolutely adore. Miss Shameika Rhymes. Yeah. Okay. Okay.
Wow. You made me sound
See how I'm
so
trying to be
important.
nice towards
So
the end of the
important.
year.
Thank you for that intro. I appreciate it.
Well, I figure we now back to our heiferistic ways.
Right.
So we wanted to get together because Shamika just had some surgery done. She had some surgeries that she will talk about today. I wanted her to share her story, and I feel like it's necessary. We are on this whole wellness get our bodies together journey. And Shamika has shared her journey through hysterectomy, menopause, peri, all the things as we have done here. So wanted her to share her story about her most recent journey, and see if this could help other people, other women that are out there in the same position as Shamika.
Okay.
So
So you want me to just jump in?
yeah, well, I want to know.
Okay.
Okay, so what is the latest, the update with you? You've recently had surgery back in July.
Yes. So it's been 3 months.
Okay, and let's talk about the surgery.
Okay. So I had a breast reduction. And then, you know, a little about the breast reduction. The decision was like a year in the making because I had time to think about it. It was more like my doctor was kind of like, "Are you tired of your neck hurting, your upper back, your shoulders, and just all the rashes?" I was getting rashes underneath the boobs, like whenever I sweat, and it would be like nasty, blistery rashes
Wow.
that would take forever to clear up. So that was annoying. And those bras were expensive. So I
Mm,
was a 38G. So
mm.
meeting with the doctor, a surgeon, it was like, yes, let's do it. So this will help improve um your back, your quality of life, your because I'm telling you, them teats was pointing towards the floor and on my knees. They
And
were
they get heavy.
they
They
were
get
very heavy.
heavy.
They
Yeah,
were
yeah,
heavy.
yeah.
And so and mine were also dense. So it was like
Mm,
super heavy.
mm,
And it just made me look not proportionate, I think.
mm.
So after some back and forth, I was like, let's do it. So then while I was there, and it was something my primary care doctor had said, she said, don't get mad when you get those boobs reduced and you look down and you see your stomach. And I said,
You know what?
say less.
Yeah.
Say less. So when I went for my consultation, I did ask because from my myomectomy and all my fibroid surgeries, I had developed a shelf. And it's similar to what women get when they have a C-section, that shelf that sits right there, like above your fupa.
Right.
And so I
Right.
asked the doctor, I said, is there a way to remove this? Because after losing some weight, after exercising, doing all the things, it's not budging. It's just still there. And he
Yeah.
said, "It's not gonna go anywhere, so we can do a mini tummy tuck." And I was like, "Well, what
Mhm.
about a full tummy tuck?" And he
Mm.
was like, "No, because I also prior to me finding out I had fibroids, I had an umbilical hernia, which now in hindsight was probably fibroids pushing that."
Oh,
So,
wow.
yeah, so I already had that repair and I had a big old piece of mesh in there for that repair. So he said, "I can't go in there and mess with that, or we'd have to redo it all." And I was like, "No." So we just
Yeah.
did the mini tummy tuck, which is below the belly button to remove that shelf. And so I was like, well, I don't want the upper part of the stomach to be all rounded and then the bottom be flat. And
Yeah.
so that's when we decided to do lipo on that part. So those are the three procedures that I had done 3 months
Now
ago.
now were you having and usually when women have let's just start with a breast reduction
Mhm.
because I feel I may need a little tuck, a little tighten and hoist, okay, a little hoisted because these things I've never been top heavy, and I know some people that I know personally will probably argue with that because they've seen me top heavy over the past 10, probably 10 or 12 years, but that's
Mhm.
weight gain. But
Mhm.
I'm not naturally a top heavy person. And I
Yeah.
almost hate to use that word top heavy because that's what old folks used to say. She top heavy. But I've never had that. I've always had B to C cups,
Mhm.
so I know I feel with my size now it's starting to to hurt my back, my posture,
Yeah.
and I know a lot of women get this particular procedure done because of that. Now, was that
Mhm.
something that led to yours, or were you just, were you outside of the other things that you were experiencing, did you also have the back pain and just things with your posture?
Yes. So mine was the back pain and lower actually. And so it was, and then I was rounding my shoulders and hunched
Yeah,
over a little
like
bit.
I'm
So I
doing
was
now.
at the chiropractor a lot and the neck
Mm,
pain. And then I was trying massages. I was trying all the different things, acupuncture, all that stuff, because it was like, why are like this area here, the shoulders
yeah,
too hurt? Because it's gotta, that bra gotta hoist all that
yeah,
up.
gotta tighten it.
Yeah,
Yeah.
so it was a lot of pain, and then um my biggest issue though was the rashes, but then it was also I did not realize until because I was getting knee injections, and then when I was talking to my orthopedic doctor, he said, all that weight and the way that you're leaning forward and hunched over, that's like pounds of pressure on your knees."
Mm,
And so yeah. So fast forward to now, I just went to the orthopedic doctor like 3 weeks ago because it was time for my gel injections. This is the first time, and I've been getting these gel injections for almost 2 years. He was like, "There's no inflammation in here. None,
wow.
none." And he was like, and it's like, he said, "How many pounds did they take off your chest? Because that and your stomach, because he's like, think of each pound is like 10 pounds of pressure on your knee."
Yeah,
So
yeah,
he was like, "So if you're overweight, your knees are gonna hurt because that's all that pressure
yeah.
being placed on your knees." So he was like, "You probably won't need these injections anymore." Because he's like, "I live in a townhouse, so going up and down the stairs
Mhm.
has been a lot on my knees."
Yeah.
Yeah, so
So that, I didn't think that, well, I didn't think that there was a connection to
mhm.
other body parts. Now, I knew the back
Yeah.
could be affected if you are pretty, you have a heavier uh chest area. So I never knew how it could affect your knees and your
Mhm.
overall, if you're standing, if you're walking, that is pounding too down,
Yeah.
radiating down your legs as well. So I didn't
And
know.
honestly, your pelvic floor too.
Yeah.
You're
Yeah.
It's just all going down.
Yeah. So you decided to have the surgery. How take us through the process of that, of coming to that decision. And did you look locally? What did you do to finally decide to have surgery?
So once my primary care doctor, she mentioned it, and then she said she'd had it done. So I'm like,
Mm.
"Well, let me look at you. Okay, you look proportionate. You look good." And I was like, tell me what it was like. What was the pain level like? And she said that she was in pain for about a month.
Mm,
And she was like, I'm good. So what she did was she said, I'm going to recommend you to refer you to the doctor that did mine. So
mm,
that made me a little more comfortable because I was like, I don't want to go to one of these, and I hate to call it a chop shop, that these
yeah.
people, where they just get you in and out. There's no aftercare, none of that stuff. And she also said insurance may pay for it.
Mm, mhm.
So that was like, okay,
Yeah.
now I'm interested. So I did a little research. My older sister had a breast reduction, talked to her. And
Mhm.
so I thought, you know what? Why not? I might as
Mhm.
well. Because I'm
Mhm.
like, the biggest problem when I was looking in the mirror, the biggest issue I was having with my clothes was I just felt like, I was like, I feel like a linebacker. It's just all big up here,
Mhm.
right? And my
Mhm.
t-shirts were starting to rip under the arm. Now, granted, I probably could have got a bigger size, but
Indeed.
my t-shirts were all ripping under the arms, all my
Mhm.
good t-shirts that I loved. So I was like, yeah, it's I think it really wasn't, it didn't take me long to decide. And then I was like so that was last year, probably like May.
Okay.
I couldn't get in to get my consultation till this past April.
Wow.
And then they referred me, whoever did the scheduling sent me gave me the wrong doctor, not the one that
Mhm.
did my doctor's surgery. So this doctor, I walk in, and I don't think I've ever felt so body shamed by a doctor before,
Wow.
because
Mm.
he immediately, the energy was off. And that's why I'm like, if it don't feel right, don't let that doctor cut on you.
Right. Right.
Because he's basically was like, I said, what size can we go to? Because I'm a G cup. What size can we go to? We don't do sizes. He was like, we do it by, what is it, milligrams, ounces,
Centimeters, yeah.
whatever
Mhm.
they do. And I was like, okay, but whatever, I don't know what that means. Like,
Right.
you got to talk to
How
me.
would you know what size a G is in centimeters or whatever they use? That's okay. So that's strike one.
Yeah, yeah.
Mhm.
So, they have you, I'm gonna just walk out through the consultation. So they have you take your clothes off, basically, your shirt. If you're just going in for the breast reduction consultation, you take your shirt off, take your bra off so they can look at you because they have to take pictures for insurance purposes.
Mhm.
So you're standing there in all your glory, and they're touching them and seeing how heavy they are, measuring them, and yeah, it's uncomfortable. I just looked at the ceiling because it's
See, that's what I don't like about male see, I'm just a female doctor person because I
yeah.
would be standing there like, is he holding it in his palm to actually feel the centimeters or the pounds of this, or is he copping a little bit of a touch? Like, I don't know. And I know that's so unprofessional. I know there's doctors that are so professional. They have these things, holding these things, hoisting them all day long. They ain't thinking about none of that. So he was standing there,
Yeah,
taking his
hoisting them
hoisting
up
them up.
and taking pictures, and the nurse was in there too. So it was like, I
Mhm.
was cool until I was already kind of put off by some of the questions he had, which was he was just going down the insurance checklist. And as I was giving an explanation for each thing, he was just like, you don't have to convince me you need a breast reduction. I'm answering your questions.
Right, right.
So that's another strike. And
Yeah.
so I said to him, while I'm standing here naked, half naked,
Mhm. Mhm.
let me ask you about my stomach. Because and that stomach thing, I didn't even really think about till I got in that office and I was
Okay.
looking at the pamphlets that were sitting there. So I thought, okay, let me just ask because I'm here. And he
Mhm.
was like, well, that won't be covered by insurance, but we'd have to, he said the same thing. We'll have to do the mini tummy tuck below the belly button just to remove the shelf. And he said, I'm not going to do lipo for the top part. And then he said,
Mm.
actually, you could just lose weight.
Yeah, oh, I almost cussed.
That's what he said. And the nurse, she was standing in the corner of the room. Her eyes got big, and he said, you're a few pounds from being obese according to the BMI scale.
All right. All
Um,
right.
okay. I said, well, I have lost some weight. I am a woman of a certain age that's
Mhm.
black and perimenopausal and
Mhm.
hormones jumping like a disco. So I was like,
Mhm.
so pre-diabetic, all the things. And he says
Mhm.
to me, you could just stop eating.
You know what? See, that is where I think I would have cussed him out and left. I would have granted myself the ability to cuss him out and leave.
I was so in shock and he just
Yeah.
kept going. He was like, you go gluten free. He stands up, skinny white man. I'm gluten free. I said, well, sir, I've been gluten free for a few months. And I was like, and as a pre diabetic, I can't just stop eating. That's not how this works. And he says, oh, maybe try exercising. I was like, I do. And then he's like, well, we can do the surgery. And I just said, I did in my head, I was like, nah,
Yeah. Yeah.
nah. I was like, I'm gonna write a review. I'm reporting him to everybody I can find.
Oh
No.
yeah. Oh
And
yeah.
so when I left, I did cry in the car because I was like, it made me
Mm.
feel so shamed. I'm like,
Mhm.
I'm already standing
Mhm.
there naked in front of you. And then this
Yeah.
is how you act. Like you're a plastic surgeon that
Mhm.
deals with, because he was part of the healthcare system here. He's not like, it's not a private practice that's like on their own. So
Mhm.
that I was like, in that particular office also deals with breast cancer patients. Is that your bedside manner?
Wow. Wow.
Right. So I immediately made an appointment with my primary care, went in there to tell her because I was like, I'm not doing this. You got to refer
Right.
me somewhere else. And
Right.
she was like, wait, why did you see this doctor when I sent you to this doctor? I was like, whoever did the schedule is
Mhm.
that's what happened. And so she was like, nah. And when I told her what he said about me being obese and needing to stop eating, she was like, she was pissed. She was furious. She was going to call over there. And she was like, you're not obese. We've already talked about your weight. You're not
Mhm.
even close. She was like, you're fine. And so I said, okay, I'll give the other doctor a shot that's over there. I'll give him a shot
Mhm.
since he's the one that actually did your surgery. It was like night and day.
Yeah.
Met with him. I had to wait another month, but got in there with him. He was like, what size do you want to be? What size cup? And I was like, now the
Mhm.
other doctor said y'all don't do it by cup size.
Yeah. Yeah.
And no, it was like, yeah. So he just was like, no, what do you, he's like, I think you'd be a nice C cup. And I said, okay.
Now, was he a younger kind of a younger doctor or older than the last doctor?
They are probably, he might have been a little older,
Okay.
maybe,
Maybe a
maybe.
more seasoned
Hmm.
in certain things. Okay. Mhm.
Yeah. And so, and I looked him up before I went and he had 5 stars across the board. So I was like, okay. And
Mhm.
he answered every single question. He took his time and he is very meticulous with that darn measuring tape and like, ask the question. So then I said, okay, well, while I'm here, let me ask you about my stomach area. And he was
Mhm.
like, yeah, we can't do the full tummy tuck, but we can do the mini. And he pinched and pulled, and I was like,
Mm.
okay, all right. And he was like, yeah, this is a bunch of scar tissue in here. This isn't
Mhm.
going to go away with like losing weight or exercising or diet. We can take
Mhm.
this off if this is your biggest concern. I was like, well, the whole stomach is my biggest concern.
Mhm.
So he was like, well, we can do some lipo up at the upper abdomen and you'll be good to go. And
Mhm.
he said, we went through the checklist for insurance. He took the pictures and I felt very comfortable with him because he
Yeah.
took the time. He wasn't rushing. He took the time to answer my questions. But meanwhile,
Mhm.
that other doctor did call me after I posted that nasty review and went above his head to different people. And he was like, I'm sorry that your feelings were hurt, which is not an apology.
No, not an apology.
And he said, I'm happy to do your surgery. I said, no, you don't. You're not
You
doing my
think I'm
surgery.
gonna have you touch on me and cut on me, as they say? You ain't gonna be cutting on me after you just said that, and I done reported you, and I done wrote a review about you, and then I'm gonna lay on the table?
Right.
No. No, sir.
Yeah.
No,
Yeah.
thank you, though. Mm-mm.
Right. Now, I will say there is, and I guess for each insurance company it's different, but there is a checklist. Like they're going to
Mhm.
ask, have you tried going to a chiropractor? Have you
Mhm.
tried losing weight? Have you met with a nutritionist? Have you done all these things? Have you had rashes? How many rashes have you had? Like, have you been treated for back pain,
Mhm.
shoulder pain, neck pain? It's like a long, comprehensive list of
Mhm.
things that they need to approve it. And so some people, I think it takes a couple months to get approved. Mine was approved in like a couple weeks. So mine moved
Okay.
really quick. So this my consultation was April. They were like, "We can get you in for the surgery like May or June." I was like, "No, I need time to prepare and get wrap my
Yeah.
brain around this." And
Yeah.
so yeah, so insurance, my insurance did pay for the breast reduction. I had to pay out of pocket for the lipo and the mini tummy tuck. So, but the good news is because the doctor that did my surgery, he was like, "I am so sorry that my colleague acted like this." So he gave me a discount
Mhm.
on the mini tummy tuck and lipo. And then he did the additional lipo because he was like, "I'm already going to have the lipo machine out." So he did like right here, I call them the wings right here,
Mhm.
and then the side boob. Um,
Mhm.
and then he did my fupa, y'all. He did he
Oh,
did the
wow.
mound.
Not the mound.
He liposuctioned the mess out of that.
Oh gosh. Wow. Now, when he said there was scar tissue, where does scar tissue come from? I mean, is that from previous surgeries? I
Yeah,
know
because
scar tissue can come from.
Yeah, because I've had a, if you think about it, I have had a lot of surgeries probably since my 20s.
Okay.
So, yeah,
Mhm.
so I've had a bunch of just laparoscopic surgeries. I've
Okay.
had of course, the umbilical hernia repair,
Mhm.
then the myomectomy,
Yeah.
then I had the hysteroscopy, I had then the hysterectomy.
Mhm.
I feel like I'm missing a surgery, but there was just so many.
Yeah.
So it's just over time that scar tissue just forms into a shelf.
Yeah. Yeah.
Yeah.
So you went in, you had the surgery, you had the procedures done. How long did it take? Because we're in October now, so this was July.
Yes.
So how long does it take for you to feel, as you're back kind of back to normal or getting back to normal? How was those first two couple of weeks after surgery though? Because I
So
know you got on my nerves, but I'm sure.
those first couple weeks, like I had to have somebody here. My mom was
Yeah.
here 24/7 because I could not. So you're wrapped. Your chest is wrapped in an ace bandage. Mine was. I think different doctors do different things. Mine was drainless. I did not have a drain for the breast reduction, and so you could not shower for 3 days because you cannot take that off. So
Mm,
um, you're having to do sponge bath, and
okay.
I had a drain on my hip for the mini tummy tuck part. So
Mhm.
that and you're having to change that drain or empty it every so often and record how much fluid is in there, what it looks like. Um,
Mhm.
yeah, it's a lot. But I also purchased a lift recliner because I
Mhm.
was like, my mom unfortunately had broken her humerus bone in her arm, which is right below the shoulder,
Mhm.
7 weeks before I had surgery. So I knew she wasn't going to be able to help me get up and down. So I bought a
Yeah.
lift recliner so I could just hit that button and help me stand up.
Yeah. Yeah.
And also, I slept in that recliner because it was not comfortable to get on the bed. So I spent a lot of time in that recliner, slept
Yeah.
in it for probably almost a month.
Oh my gosh.
Yeah, slept in that for almost a month. But like even showering, my mom had to do everything. Like I could
Yeah.
not, she would have to, and this is like you get humbled real quick.
Oh yeah.
Because my mom was like, I told her she was in there scrubbing me like a zoo animal with that shower brush. I was like, God, dog, let up.
Washing the sin and the evil
Right,
away.
basically.
Just scrub it out.
Yeah, so it would be like I would hit my, my privates and under my arms and around,
Mhm.
try to do all that by myself, but like my legs and my back and all that stuff I could not do because
Oh
also
my
you
gosh.
can't lift your arms, so you're like this T-Rex
Yeah.
because you can't lift your
Yeah.
arms for weeks. So, having her to pull my hair back or wrap my hair or whatever, all that deodorant, like you can Had to get spray
And
deodorant because I was like, I can't roll that under there because I
yeah.
can't retch across.
Yeah, yeah. Well, either that or you a musty demon because
Yeah, so
you
she was
can't.
having to help me get dressed, help me put
Mhm.
my underwear on, put lotion on me, like all the things. It was like being a child that can't do anything. But I drew the line. I was like, I'm gonna figure out how to wipe myself. We're not doing that.
Oh my gosh.
Yeah, because you literally, because you think about it, you can't. Your whole torso
Yeah,
is bandaged up or got tape all over it, and
yeah.
so turning to try to wipe back there. So I bought one of those portable bidet things that helped, but then I just went back to have it. I don't know if you had this issue when you were it or when you had your hysterectomy.
Mhm.
How did you wipe?
Very slow and gentle. I mean, what, rushed around? I retched around there. I had
Yeah,
to. I
yeah,
mean, I didn't have I didn't have nobody do that for me now, and
yeah, I
I
wasn't
wasn't
going
gonna
to
be
either.
a messy beast either, so I had to just endure the pain. But, they got little gadgets now that like the gadgets that you get for when you're trying to reach up on a high cabinet or something and get a
Yeah,
bottle down. They got the same thing for that kinda stuff. I just
yeah,
never felt to get nothing like that, but
yeah, it helped. And I, um because yeah, I was like, I am not about to ask her to come in here and help me wipe. I'm not
like,
doing
you
it.
just have to brace yourself because that's a lot of core, like,
Mhm,
we don't realize how important every single
mhm.
body part and area is until you get in a position where you can't move or you've
Yeah,
had surgery on your core
mhm.
and that midsection, it you can't bend, you can't stretch, you can't lift, you can't move, like,
Right,
you have to learn all new ways of how to get around that while you're
right.
healing. So,
Yeah, mhm. Yeah, and there was, even the compression socks, we would go through a time with her trying to
oh
get those
gosh.
on.
Ugh,
It was yeah, and even I was telling her, I was like, bath time would take an hour because, we'd have to then pad up everything under the bra, like the gauze
yeah,
pads, put,
yeah,
make sure, and then along my incision, just to make sure nothing was rubbing and pulling and doing all that.
mhm,
That would take forever because it would be like, okay, and then trying to put me back in clothes and then get me
yeah.
situated. And, I like to have concerts in the shower. So that took time.
But you couldn't take a actual shower. You had to do a bath
So the
for a
first three
while.
days I had to do the sponge bath. Then I could take a
Yeah.
shower, but it was like
Okay,
don't
okay.
let it hit the water could not hit directly.
Directly, yeah.
Yeah. So
Oh
and
my
it couldn't be
gosh.
hot. So you had to do kind of a lukewarm type of shower. So it would be a whole thing.
See, the healing process, this is what I think, a lot of people don't take into consideration
Mhm,
is it's all fun and games.
mhm,
And it sounds good to you in the beginning until you have to go through that healing process. And
mhm.
it's long. This is a long healing process. It's not,
Yes.
what they say, oh, the surgery is quick in and out, whatever. You'll be back to your normal self in a couple of, weeks. No, this
Yeah.
is now October,
I
and
am still not
you're
normal.
st
I mean, I know what you're thinking, but
I mean, well, I'm glad you clarified.
I'm still not 100%. I still don't feel like me yet
Yeah.
at all. Like I still feel I keep saying fluffy and just like tired
Mhm.
and because stuff is still happening. Like it's still, right now I'm going through the spitting sutures, which is basically the dissolvable stitches they're tired of being inside and they're just pushing themselves out. My
Mm.
doctor did say, like, you're having an unusual amount. And she said
Wow.
part of it could be stress. And I probably went back to work maybe a little too soon dealing with a micromanager. So
Yeah.
that has stressed me out. Um, Oh, I wanted to go back to the healing process. So for the first
Yeah.
week and a half, I could not stand up straight because of the mini tummy tuck. You're supposed to be kind of hunched over. Now, some
Mm.
people I saw walk that have had the full tummy tuck, they walk with a walker. I didn't need to do that. I just my mom was like, well, you could use a cane. I was like, no, I'm good. So then you add on back pain from walking around bent
Yeah.
over, and then you just have to slowly try to you slowly stand up because you're not supposed to be trying to stretch that area
Yeah.
for a little bit. So that's the other part. I know a lot of people have questions about the scars. I wasn't
Yeah.
concerned about the scars, but I thought about this too. Like I just went from a a little myomectomy scar that's this big to like one that's hip to hip now.
Yeah.
And I was like,
Yeah.
you know what? It's low enough where I was like, who cares? I mean, mine, so with a mini tummy tuck, the scar can still be the same as a regular tummy tuck, depending on how much skin they need to remove.
Yeah.
Some people do get that smaller C-section type of scar, but
Yeah.
mine was all from hip to hip.
Yeah.
Um, and he did remove 4 pounds of I guess skin and fat off my stomach.
Mm-hmm.
And then a pound and a half off my chest.
Wow.
Yeah. So um the other piece of advice, don't get on the scale. Don't get on the scale till the swelling goes down.
Yeah, because the swelling is because it's still going to be swelling. Like you still have swelling right now because the body is still
Yeah.
healing. It's still in its healing process, and that does not, happen slowly
Right.
or quickly. I should say it doesn't happen quickly. Um, the scarring. Now
Yeah.
that is something that I know I've seen
Mhm.
from I know a person who a woman who's had this and she showed me her scar and I remember being just horrified of like, oh my God, that's huge. How are you gonna, a lot of women get like what she did. She had a tattoo. She got a tattoo to kind of cover it and it makes
Mhm.
it look good. What I appreciate about what you said when we were talking privately, and I'll just share a little bit, but you said, um, you know, I I look at it this way. I want to be able to feel good about myself. It's
Yeah.
not about the aesthetics now. It's about how am I feeling about myself if I'm
Mhm.
comfortable in my own skin. So I'm okay, a scar is a scar. Like
Mhm.
our bodies have battle scars.
Yeah.
Period.
Mhm.
We both have a scar from our myomectomies. We both have scars from our hysterectomies, whether it's the little ports or whatever. And I mean, our bodies are not gonna we're not gonna look like we did prior to, but it's
Yeah.
about now. And you get to a point where you're like, I want a quality of life. If I have to
Mhm.
have a scar, I don't give a damn. I want
Yeah.
to have the quality of life. And I remember when you said that, because I said, I wonder how she's gonna think about this scar, and I saw how you just handled it like, okay, yeah,
Mhm.
and I feel better, and look at this, and she flashed me, y'all. So
Ah!
I had she the best, but it was good to see that because for some women it could be more of a mental thing
Mhm.
after everything is all said and done, and I didn't really feel that, at least not to me. You didn't feel that way, but did you feel like maybe any kind of emotional or mental issue when you started to see the scarring or as you started to heal or
I will say, and I didn't mention the scar for the breast. It is literally the scar goes from like your it's not all the way to the back, but it's under your arm, and then it comes all the way around and then up betwixt
mm,
the boobs, and then it's the right up the front of the
yeah,
boob and then around the nipple
mm,
or the areola. Yeah. So it's like it just depends on your doctor's technique and how much tissue they have to remove. So sometimes they may
wow,
not have to go all the way to the back, but for
yeah,
mine and my heavy ones, he had to.
mm,
So I will say the biggest shock was like I immediately when I woke up out of surgery, I was like, they're smaller, right?
yeah,
They're smaller. Okay. But and so it was like that anticipation of, okay, I cannot wait to take this ace bandage off. Day 3, I cannot wait. And when I
wow,
got it off, my mom and my sister were helping to unwrap it because I was so afraid watching YouTube because one girl said she passed out because that pressure of yeah. So
yeah,
I was like, okay, I need y'all, one of y'all got to catch me if I pass out. But
Oh my
but what I
gosh.
did before, I was like, I'm gonna have some electrolytes and eat before we take this off, and that helped. So
Yeah.
I didn't
Yeah.
pass out. We took it off, and I looked in the mirror like, did he mess up? Because why are they look like juice boxes turned to the side. They were square. And I was like,
What?
this ain't what I signed up for. That it was like a shock, but then it was like, okay, I went back and looked at the paperwork, and it was like they have to. It takes time for them to drop and shape into what they're
And
supposed to be.
settle. Like
Yeah.
leaving
So over
cookies on the
time,
counter.
they're
Like
still
after
a
you
little
bake
squared.
cookies, you put the
Yeah.
cookies on the counter, you let them sit for a little while, let them settle.
Yes, yes, that's a good way to
Oh my
describe it.
gosh.
Yeah, so
Oh,
and it was a shock because having bigger breasts, the areola, mine were huge, and now they're not. So it was like, well, whose titties are these? And one nipple was inverted, and I was like, now what the?
I
So,
quit.
so it's both beams are shining brightly 24/7 now. So
You know what? I worry about some people that listen to this show and be freaks. And we sitting here talking all y'all don't turn into this show if you gonna
right.
be this is helping women. Okay. Wow, so that was ooh,
Yeah, so it was a shock, but then once over time, because to me now my torso looked extra long because my belly button's not in the same place. Because you think
okay.
about it, he pulled that down,
Mm-hmm.
and it was just like, this is not who body is this? So now it's getting adjusted to this don't look like the body I had,
Okay.
but I don't recognize this body. I don't know what to do with this body because and I was like, and I just look like a square, like just with swelling, with a
Wow.
ton of swelling. So
Yeah.
it has been emotional because it was to me, it was this, did I mess up? Should I have
Yeah.
done this? Should I have just left it the way it was? Is it, should I um because to me with the swelling I look the same, and that's the other part when I look in the mirror, and actually talking to a doctor on my show Celebration, she mentioned this, that it's the slight body dysmorphia because you're
Yeah.
still swollen, so you look in the mirror and she's like, and you're with yourself all the time, so of course when you look in the mirror you are
Yeah.
going to see the same body you've been looking at. You're going to still
Right.
think it looks the same, nothing's changed. Whereas I've run into people, they're like, you look like you lost weight. And I'm like, I'm fluffy right now. What are you talking about? So
Yeah.
it's
Yeah.
like, I don't see a difference I mean, I see that these are smaller, but I don't see a difference otherwise when I look in the mirror right
Yeah. Well,
now.
I did. I when you showed me with her shirt on, y'all, but I could tell the the difference. I could honestly see the difference. And I was like,
Mhm.
"Oh, wow. Those," and then they sitting up, so I
Oh,
was
yes.
like,
A
"Oh,
lift is
wow.
included with a reduction, y'all. A lift is included.
A lift is included." See?
Yes.
And so, yeah, I could see now I can see a difference.
Mhm.
Not that I really felt like it was you were so bad before. You know, when people say, "Dang, you lost weight." Man, I
Yeah.
was a hog before. Like, why you acting like but when I saw you, I was like, "Okay, I could see it's smaller.
Mhm.
now it's proportionate. And now
Yeah.
it looks like you've always had those,
Mhm.
like for your body shape."
Right.
So, yeah, I thought it looked great.
Yeah, so it's I think trying to go back to put on a shirt that I wore before surgery, and it being
Mhm.
too tight. Like I was fighting for my life, y'all, to get that. I
Uh,
got it on, but I couldn't get it off. And I was like panicking, like, Lord, I'm gonna have to go next door and ask somebody to get me out of this shirt.
cut you out the shirt.
And I could not understand. Okay, I just had this surgery, so why is this shirt not fitting?
Yeah.
And then I went for my lymphatic drainage massage, and she was like, "It's just all the inflammation and the swelling because I did have lipo here, so
Yeah.
everything is swollen. Like
Yeah.
it was even my hands were swelling, my
Mm.
face was swollen, my ankles, everything, my thighs. I was like, I never had
Mhm.
thick thighs." My
Mhm.
thighs were
Mhm.
swelling, everything but my booty. but everything was swelling.
But that's it, and anesthesia and all of that, one of my friends, whenever she's had surgery, she always would tell me, "Shell, drain your like, make sure you're flushing your system, drink a lot of water because
Yeah,
the anesthesia can do that," which I'm not a medical doctor, nor do we play one on this show. But
right.
that's what was always told to me is that, you got to get that fluid out of you. So it was all that swelling, the drain, you needed to
Mhm.
be drained.
Right. Yeah, that's really, I mean, once I went to that, and that's the other thing. My doctor for me did not recommend me going to get massages and did not recommend, and I don't think he normally does, just because he felt, because I asked him why, he said he doesn't feel like it makes a difference. Your body will absorb that fluid at some point, and
Yeah.
having somebody that's aggressively mashing and pushing, and they could pop a
Mhm.
stitch or,
Yeah, yeah,
mess up. There's some that aren't pushing the fluid in the right direction.
yeah.
You have to really pay attention to who you're going to. And then of course with my hernia mesh, he was just like, no. And then I said, do I have to wear a faja because of the mini tummy tuck and the lipo? And
Mm,
he was like, no, you're just going to wear the compression bra
mhm.
24/7. And so that's another tip. I asked him, I said, well, I don't want to buy another one. Can you just give me two? Because it's just,
A white and a tan, or a black and a tan?
he just gave me
Yeah.
two white ones.
Yeah, of course, of course.
Yeah, and then I had a binder,
Mhm.
which I am still wearing maybe for 5 6 hours a day, a binder, or sometimes I'll wear Spanx or some tight, fairly tight yoga, not tight, but like where
Yeah.
it's compressing yoga shorts. But then after my lymphatic drainage massage, she suggested a compression tank. So that's been
Oh,
usually
yeah.
what I've been wearing. And then she's like, because my stomach, the top part where we did the lipo was felt lumpy. She was like,
Mm,
"Oh, that's from the lipo, so you've got to smooth it out with a foam board." So I've been wearing my binder with a foam board under it, and it's working. It's starting to smooth it out. But yeah, so the doctor did not recommend that I do massages or wear a faja, and I was so grateful because my sister let me use her faja, her old fajas, and I
mhm.
was fighting again for my life trying to get them on. I was like, clearly you need somebody to help because you
Yeah.
can't put that on by yourself.
No, I would imagine you can't because you're still swollen and bloated and hurting and mending, and you can't
Right.
do
And I
all of
didn't want
that.
it to rub because, it goes
No.
around your shoulders and then it comes up here. And I was like, I didn't
Yeah.
want it to rub on those incisions because, oh, that's
Yeah.
the other thing. Let me back up because you might have, so they call from the nipple down, that incision there, and where the one underneath meets, that's the T zone.
Yeah.
So it is very common for a wound to open there.
Mm.
That happened and
Okay.
I freaked out. So they give
Ooh,
you, or at least my doctor did when I left the hospital, they gave me a antibacterial ointment specifically for that purpose. Like if it
okay.
opens, use it for like a week or so, it'll close, and it did.
Yeah.
So it was fine. Um, so there's just so many little things, and then like the drain, I did get
Mhm.
an infection with the drain, around because my skin's sensitive. Around the drain, the skin got really red and itchy and hot, and I had a fever.
Mhm.
Had to call the doctor. He called in some antibiotics. Um, it calmed down, and then maybe 4 days later, they took the drain out.
Wow.
Now, I don't know if y'all want to know about removing a drain, but it's disgusting.
So did you have 2? You had to have 2, or
I
was it
had
4?
one. I
You
just
had
had
1?
one. Mhm.
Okay. And so and that's something that you had to take care of every day. You had to change out. You had to and those the drain is it's like a little sack, a
Mhm.
little thing that hangs on the outside of your body or
Yeah.
whatever, and it drains all of the fluid from whatever the body part is, and
Yeah.
then you have to dump out that little
Mhm.
bulb sack or whatever. And like you said, you're taking measurements, you're noticing the color of the fluid and all of
Mhm.
that until it decreases to next to nothing in there, right?
Yeah. And you've got to, so if you go to my TikTok on Check the Rhymes, there is a video. I took this video when I came out of recovery and they were telling me, oh, this is how you got to milk the drain. I'm not gonna remember
Not
this.
milk the drain.
I'm not gonna remember how to do any of that. So it's basically you've got to like so you can push that fluid through and so there's no clots up in there. And so I'm glad I did the video, but because I had to refer back to it, like what they say.
Mhm.
So yeah, but we were doing, I think the first couple weeks you do like every 6 hours or something like that until we got to the point where we were just doing it in the morning and at night.
Okay.
Yeah, so and it's uncomfortable because you can't just take that drain off. You've got to take it with you in the shower, take it with you
Yeah.
everywhere, sleep with it, all the things. It's like your personal little friend that you take everywhere.
My buddy.
Yeah.
My buddy.
Yeah, so actually the whiny guides told me to for the shower, they were like get a lanyard, clip it on there because you otherwise you're going to
Oh,
be just standing there holding
holding
trying
it.
to wash. And so that I was like, I've got plenty of lanyards. Let me just do that. So that helped.
Oh, wow. Shout out to the whiny guinies.
Yeah.
Wow, that's a good tip because I would have been or letting it dangle, like you can't let it dangle,
Well, then
you
it feels
know.
like it's pulling when you let
Pulling.
it
Yeah.
dangle. Yeah.
Yeah. So what are some things, if you want to give some tips, because we've always given tips right before hysterectomies and if you're
Mm.
getting ready to have a hysterectomy, what are some tips for women to have to know about these particular type of surgeries? What tips would you give them? Make sure you have this, make sure you consider that. What would you say to those women that are considering this?
I would definitely say do your research first, but I would also say get a board certified plastic surgeon because I've seen so many things going wrong with people that go to one of these. I don't want to like medical spas or whatever they're
Mhm.
called, or and these doctors aren't always board certified. These may
No.
be a dentist that just decided to get a certificate and want to play 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 with your body parts and cut cut and shape, and you'll be walking out looking like who knows what. So board certified.
Okay.
And read the reviews because I wish I had done that going even as far back as my myomectomy. Read
Mhm.
reviews, research, talk to people that have had the same surgery. Um, I would also say one thing that I didn't know is how like I thought my body was just having like a reaction to I don't know what I thought it was. I thought maybe I caught something in the hospital because I ended up with like a blister kind of like on my
Mm.
hip, a blister on my back, a blister like right up under my arm, but it was all coming from the medical tape. All like
Oh,
these were
wow.
nasty, huge blisters.
The adhesive?
Yes. Yes. So,
Oh,
my
shoot.
suggestion get some hurt-free tape because that and it's for sensitive skin that has helped that helped tremendously. I'm still using it.
Okay.
So it hurt-free skin, hurt-free. It's like Johnson and Johnson, I think, but that tape, don't use the one that they give you in the hospital. Use that
Mhm.
one. Yeah,
Mm.
so that helped. I'm still team lift recliner because it helped because you can't it is uncomfortable to sleep in the bed. A wedge
Mhm.
pillow. I'm still sleeping on a wedge pillow because I still can't sleep the way I want to. So you are going to sleep on your back for a long time.
Yeah.
3 months and I'm still sleeping on my back. But a
Yeah.
wedge pillow will help make it a little more comfortable. Um what else? For those interested in the scar treatment, I am using scar tape. That
Okay.
mess actually is miraculous. But I am using scar tape. I'm using Mederma scar gel
Yeah.
around my boobs. Let's see what else. And I think just making sure you have somebody that can help because I've leaned heavily. My neighbors have been taking my trash to the curb every
Mm.
week for 3 months. Bless their heart.
Mhm.
Having to call people like you. I hate asking people for stuff, but again, this is a humbling surgery. You have
Mhm.
to ask for help. I've had to ask people, "Hey, I really need some water. Can you go get me a case of water?"
Mhm.
Or, I thought I could drive myself to my post-op. I stood here in my friend's
Oh,
face and said,
Lord.
"Girl, I don't need no ride." As I'm still hunched over, I could do it. And she was like that? Take people up on their offers to help. So she took me to my post-op, thank God. But and you also find out that because before I would always feel like I don't really have anybody to lean on, but I found out that I do have a community of people that
Yeah.
have really been super helpful. Now, as far as how much time to take off of work, I think it's individual.
Yeah.
Most people that just have a breast reduction, the doctor was like, you can go back in 2 weeks, which I think is a lie.
So 2 weeks.
2 weeks,
No,
two
no.
weeks. Um, But then for me, he because of the other stuff, he recommended take the whole 6 weeks. But I was originally going to do 8 weeks, but because my money was looking funny, I said, let me go
Hmm.
back at least, a few hours a day and then each week increase.
Yeah.
So I went back at like 3 hours a day, week 7,
Okay.
and it
And
was
kind
six.
of just taking your time a couple of hours a day to, get your body used to, because
Hmm.
even still then, when you do finally come back to work, it's still, I know for
Mm-hmm.
me and my hysterectomy, that was, I was
Yeah.
supposed to do 8 weeks, but even when I came back, it was like, okay, I can only sit here
Hmm.
for 3 hours, 4 hours, but you still have to take time to, even though you're ready to come back, you mentally feel like you're ready, but
Yeah.
that body is a whole different animal, and it'll tell
Exactly.
you, no, I ain't ready. No.
Yeah. Like he told me, you could go back to yoga at 6 weeks.
What?
I couldn't even lift my arms. Like I was still like this. Like, no, no, I can't. How am I going? I can't even bend over.
And you're like we're saying, October, you're now starting to feel better, and you're starting to get back to your normal self. However, there's still some,
Yeah.
areas that you still have to be careful with, because you're still on the mend. You're still healing.
Yeah. So like in my head, I'm going to yoga on in a couple days. My
Mhm.
body, it might be like, no, you're not. Like I am doing light weights, right? So
Yeah.
I am doing light weights. And this whole time I have been walking. Like, I would. So that is another thing I would suggest. You gotta walk, or you're gonna end up with blood clots or
Yeah.
a pulmonary embolism. You got.
Yeah.
They want you up walking day of,
Yeah.
even if it's just to
Yep.
the bathroom. You got,
Yep.
and you're hunched over. You got to walk a little bit. Like my sister is evil and parked halfway down the damn street after the surgery and made me walk to the house and up the incline driveway.
Oh my gosh. Oh
I was
God.
like, you can't just pull in the driveway. You got it.
Oh,
So
well,
you gotta
yeah.
walk. I mean, I wouldn't walk far. I might walk, my mailbox isn't far. I would walk to the mailbox and back, or,
Yeah.
I would try to, and then each day or each week increase it a little bit. So,
Mhm.
but I was still getting outside, walking, binder and all, looking crazy with
Mhm.
compression socks, just
Mhm.
all that. And I did forget one other thing I want to mention. When they when they put you to sleep, because this happened to me, I don't know if it's happened to anybody else. They knocked some of my dental work out.
Girl, wait. No. No, what are they doing in your mouth? Oh, to put the tube, they have to put the breathing
Yeah.
tube down there.
Mhm.
You know what? See, well,
So on the 4th of July,
nothing else
thank
be
God my
knocking down
dentist,
somebody's mouth, but
thank God my dentist answered my text, because I was like, it's in my hand right now. So can you fix this? And so yeah,
I
she met me. I had to drain and all. I was still in my pajamas. My mama drove me to the dentist, and I had to get up in that chair, and she cemented it back in and sent me on my way. She was like, this is more common than you realize. Like they don't, some of these anesthesiologists are not careful. They just knock your mouth teeth around when they stick it in. That's never happened to me. That was the
you know
first
what?
time.
I would now look now. What y'all not gonna do, I gotta come up in here from my breast
Mhm.
and my stomach, and now I'm gonna have teeth with a tooth out. Now listen, we ain't gonna be doing all of that. Okay, I would have been hot as hell.
Yeah.
I now I gotta go hoist myself up a few days after surgery
Hmm.
into a dentist chair and have them gone in my mouth.
Yep.
No, I would have had to possibly be just. hanging in my mouth closed for the duration until I could physically get back there.
Yeah,
I mean, you ain't talking to nobody, you ain't seeing nobody, you in the house.
but I needed to eat, and I needed that to
Oh,
eat.
well,
So I was
well,
like, and that's the other
there
thing.
too.
That's the other thing, no salt because of it contributes to the swelling. So I mean, you can have a
Swelling,
little
yeah.
bit, but watch your salt intake if you do have these surgeries. Watch your salt intake. Know that you're gonna be swollen for forever. My
Yeah.
doctor was like, those people on TikTok and their results, they're those aren't real. They could be
Well,
telling
yeah.
you, they could be popping up. They're like a year out talking about, look, I'm so flat. I just had a tummy tuck yesterday.
Yeah, well, we know that ain't true. We know
Yeah,
that ain't
so because
true.
that is what got me emotional, honestly. That is
Yeah.
what did a number on me. And now it's and I did a video on this on Check the Rhymes, but it was a lot of the people, men making comments about my body over the years that also did a
Mhm.
number on me. And so to hear some of these men come back around and be like, why'd you do that? There was nothing wrong with you.
Yeah. Yeah.
Like, but over time it does play on your mental, like,
Yeah.
then it makes you start not liking your body. And for me, and I just told a friend this the other day, I have not liked my body and been comfortable in my body since I was 30 years old.
Yeah.
And that was, we're not going to say my age, but that was a long time ago.
Yeah. Yeah. And this is not, that's what I'm saying. I think, and not that this has anything to do with menopause, but I think once you start getting into this time, this
Hmm.
season and stage of our life, we start looking at things a little differently, and we want to be comfortable and happy. It's not about what
Yeah.
anybody else says. It's not about, one of my girlfriends, she was telling me the other day when we were on our walk, she says, "Yeah, I'm thinking about getting my boobs done again." And I said, "Again? Wait a minute, you there?" She was like, "Girl, yeah." And I'm thinking about getting it again. And I said, "Oh, wow." And she's older. She's going through menopause, but she's like, "Look, I want to do something that's going to, make me feel better. I'm not
Yeah.
doing it for the men or my boyfriends or whatever. I want to do something that's going to make me happy now, because I deserve it." And I said, "I ain't going to be fighting menopause and self,
Yeah.
esteem or all the stuff that I'd fought as a teenager in my 20s and so
Mhm.
on."
Yeah.
So I applaud you for doing what you did. I was nervous. I was scared, y'all. I said, I don't know what. Here she go. Now she doing some more stuff again. And, but I understood. I kept saying, "Well, I don't see it. I don't see I don't see what's wrong with her. She looks good to me. Like she's not." But it's how you see yourself
Yeah.
and what you're dealing with internally, not just mentally, emotionally,
Hmm.
but physically, the other parts of this. So
Yeah.
I'm glad that you shared your story and you're sharing your story, because I'm telling you this, there's a lot of women who are going through that same, they're contemplating all of the same things, and now they have your story to kind of refer back to.
Yeah, what's funny is that the whole time I just wanted him to draw on me because I was like, I seen y'all do the drawing on TV. When are you going to
Yeah.
draw on me? He didn't do it till right before surgery, but
Oh,
the
okay.
day, like
Okay.
before they took me back. And I just thought that I wish I had taken a picture, but even then, as he's like the fupa part or the mound was not even a conversation before, but he starts circling. I'm gonna just get that. And I was like, and my mama's sitting there and she's sitting there like, what's that? I'm like,
Mhm.
but
Mhm.
so, and I'm glad that I had a doctor that was like, I'm gonna make sure that you get one, what you paid for,
Yeah.
and two, so you walk away whenever you're healed more comfortable. And
Yeah.
so, in the mornings before my swelling starts, I see abs. I'm like, I knew they
Yeah.
was there. And I was like,
Yeah.
I don't know if that's the contouring, but I knew they were there because I've been doing yoga for a year and a half.
Yeah.
And
Yeah.
so I will also say that helped, I think, with um just overall being able to move around,
Yeah.
and
Mhm.
um because I think I know I got on my mama's nerves. I got on her last nerve because she would sweep or something or mop, and I'd be like, "You missed the spot. Just let me do it,"
Mhm. Mhm.
because I needed to be doing stuff. But
Yeah.
so my other piece of advice is sit down and rest. Don't be doing the most. Sit down and rest, hydrate, and eat. Make sure you eat. So the biggest thing they were telling me, protein, um, low salt, and of course you need your fiber so you can go to the bathroom. But yeah, my nutritionist was like, carbs are your friend,
Yeah.
especially as your body's healing. And she
Yeah.
kept saying, listen to your cravings. So that helped.
Yeah. And it's and your body needs to replenish things. So that's the time to do it. Don't be going overboard now.
Right.
Cause then cause some of y'all, me, I sat there and I ate and I said, oh, I need this right now. No, you don't. You don't need it because you're gonna have a big back
Yeah.
eating. Okay. But yeah, your body, we need to listen to our bodies and our body will tell us
Mhm.
what it needs and yours needed to, get some rest,
Yes.
get some, just sit down. Sometimes that's hard for us, especially if we're on the go all the time and I'm ready after 3 weeks. I'm ready. I don't feel like staying in the house. I don't feel like
Mhm.
sitting here. But our body needs to heal right the first time. That was
Yeah.
something that one of my doctors told me. You need to heal right the first time
Yeah. Mhm.
because if you don't, then you're going to create more problems for yourself. So,
Right.
like Shameika said, take that time, take the full time that you're
Mhm.
supposed to rest and let your body do what it needs to do.
Yeah. And last thing I'm going to add to this is you may be wondering what bra size I am now. I don't know. And it'll probably be months before I know what size. Like right now, I have a bralette on. Bralette. I couldn't
I'm
have
not a
a bralette
bralette.
before, but I have a bralette on, and it's a large and it's a little big. I just
Mm,
went into Target and picked something because I was like, I need something softer to wear because I do have an open wound right at the moment. But
yeah.
yeah, I'm like, oh, this is not, and they're sitting up without no wire or nothing.
Hmm.
So yeah, it's those things get me excited. Like I can't wait to wear a dress that I can, maybe show a little cleavage and not have to wear a bra because they'll stay up.
I mean, that's the benefit, that one of the benefits of it. I think I just got a bralette the other day. I bought some stupid one off of TikTok and that thing I put that stupid thing. I hate TikTok store for this. I brought a bralette. It was cute on the big breasted woman that had it on. So I said, okay, this is gonna work for me. Why did that thing just cut both teats in one side of the bra? It's gonna do. Anyway, since you said bralette. Okay.
Yes, yes, yes. That is too
Well,
funny.
well, I appreciate having you on our show today, although you're on here all the time.
Yeah,
But
I'm always here. If y'all have any other questions, you can shoot me a message wherever and I'm happy to answer it. I did have my neighbor ask me this question. So I guess I should address it because somebody else
oh,
might have the same question really quick. When they do your tuck, they do pull your cookie up. So it may not be in the same spot it used to be.
girl, what you
Just
mean?
so you may have a more prominent camel toe if you're wearing specific things. So just so you know, because I did not realize it until I was out at the store and I looked down like, oh God. I think I walked past a mirror and I was like, oh gosh, my shirt won't cover this up.
So that shifts too.
It does because they're pulling it up.
The
So
skin, the
mhm,
belly. Oh Lord have mercy.
yeah,
Well, hey, some of us need it, like that one doctor said it'd be down there dangling,
right.
like he said.
So because they do the lipo there, that was another shock because it was so swollen down there. And so when I went to go wipe, I was like,
Oh gosh.
something's wrong. Like it huge, like just the swelling. But once they took the drain out, a lot of that swelling went away from that area. So I
Well,
don't know.
that's good to know. I'm glad you said that
Yeah.
because we don't need it. If we don't need that to be uh moved and huge now and expansive.
Right.
No. Oh my
Yeah.
gosh. Well, if y'all have any other, we may need to do a second
Okay.
show on this, a part two. But if y'all have any questions for Shamika about the breast reduction surgery, about tummy tucks, about any of those things that she talked about today, definitely reach out to her. You can send her an email through our Ladies Edition podcast on Facebook, Instagram, TikTok, and to our email, ladies edition podcast at gmail.com.
Mhm.
And we thank you for telling your story. I appreciate you for sharing. I know it definitely is inspiring when we have guests, including our co-hosts, to talk about the things that they're going through and things that they have tried and you know um done for themselves. So we appreciate your honesty and your sharing.
Well, thank you for having me. This was such a wonderful experience.
Yeah.
This is a marathon, not a sprint. It's a journey. So, we'll see where I'm at and when I hit the year mark. Maybe I'll fit in my clothes by then.
It shouldn't be that now. Come on now. But catch us on our next, we will have another episode soon. So check back. Otherwise, subscribe and listen to our podcast everywhere where it's streaming. Don't forget to like our and follow our Facebook, our social media, our Instagram, our YouTube as well. Ladies Edition Podcast. That's where you can find us on all social media. And just let us know if you have any questions, if you have anything that you want to have us follow and talk about and have guests on. Send us a message and let us know.
Well, thank you, Shelley, for having me on again every time we have
Every
the show. But
time,
thank
girl,
you for
you
letting
know.
me sit in the guest seat this time.
Yeah, I did
Yeah,
right by you, I
you
feel.
did. You did. You
Okay,
did for once.
good.
You did.
Woo. All right, y'all. We will see you next time on Ladies Edition. Take care.
Bye.